You don't think of early childhood classrooms as dangerous places. But imagine yourself with a group of 4-year-olds and a child loses control. He begins lashing out at his friends and throwing things hard enough and wildly enough to cause injuries. What do you do?
We want to recognize that we're people, we're humans, and we're going to react with instinctive responses. Our instinctive response may actually be not the safest and the most effective thing to do. You know, our instinctive response may actually present greater difficulty for the child and may also present greater risk for us. So the reality is that sometimes it does require training to replace some of those instinctive responses that we have with learned responses, which would be aligned with safe and approved methods of physically responding to situations.
In a crisis, you're not going to have time to carefully consider your response. To keep everyone safe, you need to act immediately. It's wise to plan ahead.
But in the case that there is one child whose behavior is of that much concern, part of what I oftentimes will do as a consultant, for example, in a classroom, is I'll say to a teacher, let's develop a safety plan. I'll do this obviously with the family and say, what's going to make everybody safe? It's not just about my safety, it's about the other children's safety, and it's about this child's safety. And safety plans might include things like, when somebody's really upset, here are the things that we do. And those things might be that maybe there's a quiet space that this child goes to. Maybe there's a different part of the building where that child goes to, and there's an adult there that helps that child calm down. We obviously want to help that child learn some calming techniques and other sorts of things. And my experience has been is that when we have all of those things in place, the teachers really can do their job and work successfully with this child and maintain them in the classroom.
Children who may use dangerous behaviors can learn calming techniques, or with a teacher who recognizes the child's behavior cues, anticipate a problem, and move to a safe space before the situation escalates. But a child who is out of control is not involved in a teachable moment. When a child is using dangerous behaviors, don't try to confront or remove the child from the classroom.
In the moment, we're going to do what we can to keep the child safe, to keep the other children safe. That may require directing the other children to remove themselves from the immediate area. It might require us to scan the environment and quickly remove access that child may have to objects that could become unsafe for the child or for others. We also need to be aware of our position with respect to the child. We might think that getting close to the child is what that child needs, and the child may actually do better if we back away and give a little bit of space. If we do need to get close enough to the child, it's much safer to do so by positioning ourselves to the side of the child as opposed to directly in front of the child.
Responding effectively to dangerous behaviors sometimes requires specialized training. Physically grabbing or restraining a child can cause injury and may pose liability concerns in some states. In situations in which dangerous behaviors can be anticipated, early childhood professionals should get the training they need. For more information and advice on responding to these situations, visit the website of the Technical Assistance Center on Social Emotional Intervention for briefs on preventing restraint and seclusion. One reason dangerous behaviors require planned responses is that a child who has lost control, his friends, and adults in the room are all exposed to the risk of injury. That's why everyone needs to be involved in planning and practicing what to do if a threat arises.
Part of what teachers can do is see things as teaching opportunities. And this is a great teaching opportunity, not just for the child who's having difficulty, but for all the children about what do you do if you don't like what another child is doing. And that can range from sort of these highly challenging or aggressive behaviors to more subtle sorts of things. And that's a skill that you really want to be able to carry for the rest of your life. Is so if somebody is bothering you, what do you do? And if we do this as a classroom, then we all are on the same page in terms of what behaviors are okay, what behaviors are not okay, and what do we do if there's a behavior that's bothering us. So it's not we respond in the same way, it's maybe we ask an adult. And so perhaps there's 2 or 3 things that everybody in the class understands, that when somebody is doing something you don't like, here are the 2 or 3 things from which you can choose to respond.
As with all challenging behaviors, you don't have to address dangerous behaviors on your own. Work with families to get help.
If you have a young child, 3, 4, 5 years old in the classroom that's engaging in challenging behaviors that are so severe that they're actually harming other children, then there's a good possibility that this child has special needs. And if not special needs due to cognitive or linguistic issues, certainly special needs in terms of social emotional concerns. Get an evaluation for that child through the local school special education program. Even if you're not in a public school, the child lives in a school district and is eligible for those services. Those services can also provide for that child additional support, such as, if necessary, a one-on-one aide that would be able to go to the classroom with the child, be able to support the child, and be able to teach the child social emotional skills as the child is being contained in a way that child's not going to be a physical threat to other children. There are ways around these issues other than just expelling the child or getting angry at the child or asking the parents to come pick them up early. There are supports that are available. In some cases, that means special educational supports. And if special educational supports are warranted, then it's not just a matter of whether or not they're needed. The child is actually entitled to these if they're warranted for the child.
Remember to enlist family support before looking for outside help. Take time to consider how your response to dangerous behavior is affected and supported by your program's policies.
What's the policy? What's the policy where you work? What's sort of the legal ramifications of these things? And most importantly, what is it that you've talked about with the family and with this child about how you're going to handle these things? There's a big difference between just grabbing a child because you're not quite sure what to do, and sort of you've worked with, I guess I could picture an example where you've worked with a family, you've worked with the director of the place that you work, and you've worked with this child to know, some of this is like a sensory issue, and we have an occupational therapist, and we've all worked this out that when this is happening, this seems to be helpful. We've practiced it, you're expecting it, that if you get to this point, we've sort of talked about this, we've practiced it, and now we're going to do this.
Fortunately, dangerous behaviors among children in early childhood settings are rare. That's why many programs aren't prepared to serve a child with significant behavioral needs. Too often, programs decide they aren't capable of helping a child and ask the child and family to find another program. But before you do that, ask yourself, if not your program, then where? Who will serve this child?
With leadership support, with training, with procedures, having a preparedness plan in place so that the teacher responds as expected, and in doing so, the child's needs are going to be met, and the child's needs can continue to be served in that setting. And we may never be able to eliminate the reality of expulsion, but we can put some systems and resources in place to reduce the likelihood that that can happen.